This is Dr. Skylar Pond. I'm walking back to one of the prettiest little alpine lakes there is in the Pacific Northwest, and I'm grateful to be here today. 4 years ago, I would not have been able to attempt this hike because I couldn't walk, because I couldn't stand up. I had an acute L4, L5 disc herniation that was sending radiating pain from the L4 nerve root through the groin, right down to the knee, every time I stood up. Every time that hip extended, and it stayed on me the entire time I was standing up. I was working as a chiropractor from a squat position. I was living from a squat position. I was sleeping in a squat position. And my situation was a bit of a crisis because it rapidly progressed into degeneration of the motor skills in the right leg. I had a partial right leg paralysis. The right quad was completely offline, and I know that that's a surgical pathway. You cannot leave that kind of pressure on a nerve root long because those nerves do not heal quickly, and sometimes they do not heal at all. So I hit this with everything I could. I did a aggressive, deep spinal decompression series, and I know that those nerves are still vulnerable to remaining damaged, symptomatic, and weak even after successful decompression. We see it in surgery all the time. Post-surgical disc herniation surgeries, even when successful, still have nerve pain symptoms because the nerve is slow to heal. So I looked out in the research and compiled all of the therapies that are shown to be helpful with regenerative healing, with neuroregenesis, and I did all of them. There's a lot of options out there, and I was able to compile a combination of injections, IVs, and therapeutics that gave me a rapid healing from this presentation. It was only 2 months before I was back to life as it was before. Full weightlifting, Brazilian Jiu-Jitsu, hiking, whatever I wanted to do, symptom-free, no worries. And it's been a joy to compile those therapies and share them with my patients. And what I've done is I've structured that. We can do multiple treatments a day and front end within 72 hours all of the relevant decompression and neurologic interventions and therapies, and support that with a 3-month app-based rehab protocol that I designed for you with videos for you so you can solidify the progress that you make and make this a long-term healing. So if you have further questions about your presentation, if you benefit from a combination of spinal decompression with neurologic, regenerative healing, you can contact my staff and they'll arrange for a remote sit down with you and me. You can ask me any further questions, and I have quite a few questions for you as well because I have to determine if you're a likely successful candidate for our spine decompression and spine surgery alternative protocol.